lithium carbonate, lithobid. Here's the problem with lithium. The big problem is lithium over a period of time, years, causes an interstitial nephritis. It damages your kidneys. Even if your kidneys don't fail, and I've seen that where people needed transplants, it will damage the kidneys. And by the time the blood work finds it, the damage is already done. That's a serious side effect. Side effect number 2, it will damage your thyroid. That's fairly common. You become hypothyroid, low thyroid. That's another big issue I have with lithium. Even, I would say, years of use, the thyroid will not work as well from lithium. My other issue with lithium is it causes bloating and weight gain. It causes acne of the face and the back, another issue. Other issues, it causes a fine tremor. Like this. That doesn't look good. People think you're drinking alcohol. My other issues with lithium, gastrointestinal problems, water retention, nausea, mental slowing, memory problems, forgetfulness, fatigue. Big ones, toxicity. Over-the-counter drugs like ketoprofen, ibuprofen, celecoxibid, diclofenac, naproxen, sodium, piroxicam, meloxicam. All these over-the-counter non-steroidal anti-inflammatory drugs can make lithium level toxics. And when lithium becomes toxic, confusion, delirium, it could be a medical emergency if the toxicity is severe enough and can cause cardiac arrest. So it is dangerous. Common diuretics, hydrochlorothiazide, spirolactone, chlorothalidone, bumetidine cause toxicity of lithium. Antihypertensive drugs, losartan, valsartan, irbesartan, candesartan. Those are the ARBs. And the ACE drugs, enalapril, lisinopril, rifanapril, benzapril, all cause lithium to be toxic. Other drugs like tetracycline, metronidazole, spectinomycin, antibiotics cause lithium to get toxic. Low salt diets can make lithium toxic. Losing weight too quickly can cause lithium to be toxic. Drinking alcohol can cause toxicity. If you get vomiting or diarrhea, lithium can be toxic. Going on a low sodium diet can make lithium toxic. Being on caffeine and then stopping caffeine can make lithium toxic. Rapid weight loss. I just had a patient toxic last week. That's why I'm making this video. Confusion, delirium, tremor. Then he started getting vomiting. And I said, this is serious. The treatment is, most of the time, stop the lithium. But I'm not a fan of the lithium. It cosmetically and biologically hurts the individual. They look bloated, tremor, acne. And then at some level destroys your thyroid and kidneys. I'm not a fan of lithium. Does it work? Yes, it works. Our doctors who put people on it, they argue with me. They say, well, we know it works well. It treats the depression and it treats the mania of bipolar disorder. But that can be done with other drugs that are safer, like Latuda, Caplita, Viralar, Abilify, olanzapine, Zyprexa, Rexulti, Resperdal, Brexpiprazole. All those drugs are better choices, Seroquel, than lithium. My patients, lithium is a very good drug in terms of how it works in terms of treatment. I'm not disputing that. It's age-old, tested, but it is a dangerous, and I'm not even going to call it a drug. It's third on the periodic chart. It is a element, lithium. What would they make? Lithium batteries. So it's like a salt. It is lithium salt is what you're taking. I'm not a fan. I don't recommend using it. I will do everything so my patients don't get stigmatized by the cosmetic disfigurement and how it destroys kidneys and your thyroid and all the drug interactions. I will not use lithium. You can read my articles at drmarkagresti.com. You're on my YouTube page, Dr. Mark Agresti Psychiatrist, but go to the blog on my website. Thank you.